Hi, I'm Dr. Margreet Barnard, your host of the Birth and Baby Show, brought to you by Birth and Baby and Sensitive Midwifery. We empower moms, midwives, and birth workers to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. If you're looking for a lactation consultant, visit the South African Certified Lactation Consultants website at www.salactationconsultants.co.za. For breastfeeding mothers, SACLC stands for Support, Knowledge, Compassion and Hope. It is made up of skilled professionals who are dedicated to offering ethical, evidence-based and personalized lactation care. Breastfeeding can be challenging. Mothers might experience pain, worry about low milk supply, or have trouble with latching, face medical issues, or just feel unsure. SACLC is here to show mothers they do not have to face these challenges by themselves. We do more than just give breastfeeding advice. We listen, assess, educate, empower, and support every mother's feeding goals. Visit our website to find one in your area. It is Breastfeeding Awareness Month, August, and of course we're having an episode dedicated to breastfeeding. And the topic of this episode is something that is really trending on social media, and it's colostrum harvesting and how can we prepare for breastfeeding to be successful during pregnancy. So I get a lot of questions about it, even from midwives and health professionals. And I got the expert to talk to us about it, and her name is Samantha Crompton. Welcome back, Samantha. It's the second time you're with us. She is the baby lady and a lactation consultant, as well as a professional nurse. That's your background, right?
Yes.
Samantha, thank you so much for enlightening us with your knowledge and your experience with all your work you do.
Always a pleasure. I love being here. We love being on podcasts because I send lots to my moms.
It helps, right?
It helps.
It helps because otherwise you keep repeating yourself. So you can give your expert lecture for your moms today.
Perfect.
Yeah. So Samantha, what do you advise them if they ask how can I prepare for breastfeeding when they're pregnant?
So my number one thing is I like to do a prenatal lactation consult, and the reason is what we like to do is actually get a lot of the intellectual stuff done before baby arrives, because when baby's there and we're doing a lactation consult, you're always under pressure to feed baby. You know, baby's there, they're crying. If it's really early days, like day 1 or 2, the breastfeeding parent is overwhelmed, the partner's overwhelmed. You know, sometimes you've got a lot of drugs in your system. It's a lot to do, where if we can prepare beforehand, so during the pregnancy, and the way I like to do a prenatal lactation consult is I do a full comprehensive history, which is really nice because then we can already pick up red flags, you know, and then we can prepare for potential problems that are coming through, and then you're in a good space about it. It's not a shock when it happens. And then I chat a lot around the hormones and the physiology and the anatomy of milk supply, because I think that is a big stress for our moms, which is leading to our next topic as well. So we chat a lot around the anatomy and physiology of that, so you're comfortable with it and you can manage it and assess what is normal, what is not normal going forward. And then we do a lot of practical stuff with the doll. So we practice, you know, different latching positions. How do you know baby's getting enough milk? You know, we go through a lot, and how to calm the chaos around it. So I think the number one thing is to do a prenatal lactation consult.
Makes sense.
And then the second thing I like to do, which is a different topic altogether, but I like you to actually prepare going back to work before you leave work. So I know it sounds silly, but I like you to go speak to your human resource manager, find out what are the breastfeeding policies, you know, do they allow for expressing when you're back at work? Is there a space for it? Do they even have a policy? Because a lot of companies don't even have anything. And I think it's really important to do that before you actually go on maternity leave. So don't try and do it, you know, the day before you're going back or anything, and create a space, make sure there is a policy. And then when you're going back, you're a lot more calm. And even if you if you're not breastfeeding at that point, it doesn't matter. You've already done the groundwork for it. So those are my two most important things: a prenatal consult and pre going back to work. So you're already thinking about going back. We don't want to think about it, but we have to think about going back to work.
Yes, it's the reality for many women.
Yeah.
Yes,
absolutely.
I love that. That makes complete sense. And also, hearing where you can breastfeed and how that will work in your work environment. That makes sense. So you then also probably get asked for prenatal pregnancy preparation about the colostrum harvesting. Let's shed some light. What is it? And why are women wanting to do
this? So, just a little definition of what it is. It's for people who've never heard of this.
Yes.
So there's a couple of names you can talk: colostrum harvesting or antenatal collection of milk. There's a lot of different words around it. And what it really means is collecting colostrum before the baby actually arrives. Okay, or milk.
Yes.
I don't like to differentiate because we always need to remember this colostrum is milk. It's milk. It's milk. So Correct. It's collecting milk before baby arrives to give to baby, in the early days, the first few days in the hospital. So that's by definition what it is. If you don't mind, I'm going to use my piece of paper to go through the evidence because I don't want to get anything wrong.
No problem.
So there's been 2 studies done on this, which is already very low. Okay, so that's our first concern with this. So the first one is called the DAME study, and that was done it was published in 2017. And what that was 635 pregnant women with diabetes, and 319 were put on the active arm, which is antenatal colostrum expression, and then 316 just standard care. All right. And what that showed was that the women usually start around, or what they did was the women start around 36 weeks, so it's quite late into the pregnancy. And what the results showed is that there's no harm in advising women with diabetes in pregnancy with a low risk of complications to express breast milk from 36 weeks of gestation. So can you hear, it wasn't a study on if it's a good idea, isn't it a good idea? All it was, is it safe to do? Yes, it is safe to do. Okay, for these moms. So that was the one study. And then the other one that's been done is called the Express Mom. So Mother's Own Milk is what MOM stands for. And that is actually just a pilot study. So it was done in 60 women, and they were randomized into antenatal breast milk expression for 10 minutes twice a day from 34 weeks. So they went a little bit earlier. Or the control group. And then the control group didn't express anything. And they were followed up for 8 weeks postpartum. Okay, and the primary outcome was gestational age at birth. So again, they were looking, does it cause early onset of labor or miscarriage or anything? That's what they were looking for. And then the secondary outcomes were availability of mom's own milk and breastfeeding rates from 24 hours to 8 weeks. Okay.
Interesting.
Yeah, so what it showed is there was no difference in gestational age, so it's safe. I mean, and this was done in just pregnant moms, so low-risk pregnant moms. They didn't have to have diabetes or anything like that. And then they looked at how much milk. So the intervention group had about 52 mils that they collected from 34 weeks to the date of birth. And all it's showing is that it doesn't induce labor in 34 weeks. And there's a basis for women, there is a basis for a trial among women with high-risk pregnancies or high risk for preterm labor for actually doing this. So if you know anything about studies, what you'll understand is we've got one study in moms with diabetes, which is only 600 people, which is actually a very low number. And then we've got one pilot study, which is only done in 30 women. So we can't actually extrapolate much information from a study done in 30, in 30 women. All right, so that's really just looking at the evidence of that, saying, do we actually have enough to be recommending this across the board?
Yes.
Okay, so my upfront answer is no, we don't have enough. Okay, so let's look at what is some advantages of doing it, and why I think it's sort of blown up on social media. So I think one advantage is if you are a mom with diabetes. So it can be gestational diabetes, it can be uncontrolled diabetes, and you do have a potential risk then for delayed onset of lactogenesis, which means it might take a little bit longer for your mature milk to come through. There is now an argument for doing antenatal expression.
And that's why they did that study to see if...
Yes, that's why they chose moms with diabetes.
It's a given that women with diabetes that the breastfeeding can start a bit later.
So it's not a given, and that's the thing. It's just, it is a risk factor.
Oh, I see.
So some moms with gestational diabetes or uncontrolled diabetes potentially have delayed onset of their mature milk coming through. So that's why they chose those moms. But it doesn't mean because you've got gestational diabetes, you are going to be delayed with lactogenesis. It's just a risk factor. So that's why they chose those moms. So again, it's not a set in like, I've got diabetes, therefore I'm going to have this. So I think there is an argument for our moms that we know, which is why I like to do a prenatal lactation consult. And then if we know, then we can have a discussion around this as well. And then the other argument for doing it is maybe if you know that your baby is going to go into the neonatal ICU and you're going to be separated from your baby. So there hasn't been trials done in this, but it is an area where we could explore where you are maybe a high risk for separation. So if your baby's going to for whatever reason, whether it's a illness or an abnormality or something, you're going to be separated for your baby up front, there could be an argument for doing antenatal expression. Or if maybe we know the mom has an illness and she potentially won't be able to be with her baby for a few days, postpartum, which doesn't happen that often.
Yeah, but also most of the time you don't know if your baby will go to NICU.
You don't. It's
unpredictable.
Exactly. So that's why I say it's only if we, for whatever reason, have the knowledge that we know that's going to happen.
Okay.
Yeah, and then maybe the only one which is quite sort of a little bit off center is because we have a little bit of a top-up culture in South Africa, and I think from what I'm hearing around the world in the early days, if you are very, very, very against giving a formula, then it may be more aligned with your beliefs to rather do some antenatal harvesting, and I think that is what has pushed it through on social media. But we are going to discuss a few of the concerns around doing it, which I think maybe negate some of those, that argument for it.
Okay. Yeah, I can imagine for your top-up culture, which often happens if you've had a Caesar and the breastfeeding doesn't get established straight away. And we know we've got high cesarean section rates, so I can imagine that those moms would like, hey, let me do the best I can to make breastfeeding successful. That makes logic sense to me.
Yeah.
Yeah.
So that's the thing, and I think that's why it's exploded a little bit on social media, because there's a logic behind it, and then there is a problem in our top-up culture.
Yeah.
So I think a lot of people are going, well, there's a problem, here's a solution to the problem. But I don't think it's as simple as that. And that's where I'm seeing some of the problems coming through.
Okay, let's unpack that. Yeah.
All right, so the first thing around doing this with antenatal colostrum protection is it's really hard. It's difficult to do. It's against physiology. I mean, you've got during your pregnancy, you've got high prolactin levels that are actually, high progesterone levels that are actually blocking the prolactin, and it's sort of saying don't produce colostrum yet. You're not ready to do this. So, antenatal colostrum collection is really difficult.
Yeah, makes sense.
So what's happening is these moms are starting, say, 36 weeks at 36 weeks pregnant, and then for 1 or 2 weeks they're getting zero mils, which is. The problem is it's so disappointing, and then they're starting their breastfeeding journey with a little bit of a disappointment around breastfeeding because they're potentially not getting any colostrum. So you're already starting with a low supply mindset. This is hard doing that. So that's the one area. And then the other thing is that I don't know if you use the word, but we abuse our boobs a little bit because we have to hand express because that's what the trials have shown us to do. And we sometimes do it for 10 minutes twice a day or up to 3 times a day. And, by the time the moms then, I see them, after the birth at day 1 or 2, they've got bruises, they've got inflammation, they're already feeling sore. And so it's not a good space to be starting with the antenatal collection. And then the one that I'm seeing the most, and is probably the biggest problem I'm seeing, is that parents start parents start judging how good they are at parenting by the amount of mills that they're actually able to produce.
Wow.
I know it sounds really sad, and it's a mindset, but you're sort of like, okay, I can produce 5 mils of milk. I'm an excellent mom. You know, they're measuring it, you know.
Yeah.
And then I can and we're seeing this with this pumping culture and that as well. You know, I see my moms who are, you know, those who can pump, you know, 60, 80 mils or hold it in a haka are feeling like amazing parents. And then the moms who can't pump extra, even though they're able to feed their babies perfectly, are feeling almost inadequate, which is the predatory social media marketing that's happening. So we see these moms, you know, maybe they can only do 2 mils, and then they're feeling disappointed, and I'm not a good mom, because you know how we put these things on ourselves. So they're already in a little bit of a low supply mindset going in, and I'm not a good mom, and I'm feeling guilty and everything. So I don't love that. And then the thing is also, because you've worked so hard to get this colostrum, what's happening now, say you were able to collect a fair amount, you've got these syringes, you know, syringes of 2, 3, 5, 10 mils that you've collected over the last 4 weeks. And now you almost feel, because it was so difficult, that even if you don't have delayed onset of lactation, you know, baby's perfect, didn't go to the NICU, you had a great birth, you with baby, everything's perfect, you're latching well, you almost feel obliged.
You better give that milk.
To now use this colostrum, because it was like, I worked so hard for this for 4 weeks, you know, I was expressing at home, it was uncomfortable, and you know, and you've got all this milk now sitting here, you're like, I think I should give it to the baby. So now we are feeding baby, but we're also giving the colostrum. So now baby's getting full, I mean, potentially overfed, or
it's a top-up problem.
It's a top-up problem. So now we've topped this baby up. It doesn't want to latch now. So, but now what happens is 2 days down the line, we've now run out of our colostrum that we're feeding the baby, but we haven't been stimulating our breast. We haven't been practicing breastfeeding. We haven't been practicing latching because we've been feeding with the syringe. So it's such a double-edged sword, because you've given the baby the best possible milk, because colostrum is the best possible milk, but we haven't actually been practicing latching and haven't been practicing breastfeeding. So now we come day 3, 4, 5, and I'm seeing the moms going, baby doesn't want to latch, baby doesn't want to drink, baby doesn't want to suck, I'm not comfortable doing this.
And there's no milk, maybe.
And there's no milk, potentially. So now they almost go, maybe it's easier just to express. Okay, and I mean, there's nothing wrong with exclusive pumping, but it is really hard.
Yes.
I mean, it is, it's probably the hardest breastfeeding route to take, is an exclusive pumping route. It's nice from the fact that you can see the baby's drinking 40 mils or 60 mils, whatever, but it's a lot. And then the problem is often it only lasts 3 or 4 weeks that the mom's doing that, and then they slowly start heading towards formula feeding. If it's their choice, that's not a problem. But if it's not what they wanted, now we're back to the guilt and the problem. So it's really not, you know, it sounds like, in theory, it sounds like this amazing idea. But in reality, is it such a good idea to be doing this antenatal collection? And then we look at the science of it, which we don't know the answer yet. How good is it to be freezing and thawing colostrum? Because we don't 100% know what's happening to that colostrum when we are freezing it and then thawing it and giving it to the baby. Are they getting as good an immune boosting properties? Is the protein staying the same? Are all the benefits of the colostrum, are they being lost when we freeze and we thaw? You know, from a microbial point of view, did we collect it correctly, and did we keep it clean? It can't be sterile, but did we keep it clean? Are we introducing pathogens? You know, there's so many variables and so many factors that we don't know, and we cannot tell that from the trials that we currently have. So all we know is it doesn't induce labor. It is safe to do. Some moms had good results, but it's 300 moms in the first trial with diabetes, and it's 30 moms in the pilot study.
Yeah.
Which I don't think we can make a good assessment from. And I may be wrong, but I'm not sure if they've even looked at what freezing and thawing colostrum is actually doing to it. Hopefully they will look at it, but I don't know if it's been done on a large scale. We know that we want, fresh breast milk is definitely, straight from the source is definitely number one. We know when we freeze it and we thaw it, we lose some factors. So we already know that with mature milk, and I'm sure colostrum is very similar.
Sure.
Yeah, so it's a lot.
Yeah, it sounds to me almost like, again, an intervention. We like to intervene with nature as humans, unfortunately. Yeah. And it's just another form of intervening because it's not natural to do that.
Not. Yeah.
Physiologically, if you dive a bit deep into how our hormones work and the breast preparation and how breast milk is formulated with a baby suckling and get that beautiful circle going, you just intervene with all of that, and it makes it so complicated.
It does. I mean, and if you read a lot of Dr. Sarah Buckley's stuff, she has always said, every intervention, you then have side effects.
You pay somewhere.
You can't. You go off this track, and then there's a side effect that we then have to intervene to correct the side effects. And I think this is exactly what we're doing with the antenatal colostrum collection. It's again another step in why are we interfering? So
I think we can all take a deep breath and relax a bit about it. We don't have to do colostrum harvesting.
No, we don't have to do it. And please, I'm like begging people, stop doing what the social media influencers are telling us to do, because although it seems like it's coming from a good place, there is an economic benefit for a lot of these interventions.
Wow.
And some of the marketing is predatory. Some is lovely, but some of it is predatory, and it's sort of.
What is the economic benefit? What have you seen?
So what I've started seeing coming through is I've seen certain companies, not as much in South Africa yet, but certain companies are starting to now sell antenatal colostrum collection kits. So, you can now order a kit off the internet to do antenatal colostrum, which is lovely for our moms who we know, we know she's going to be separated from her baby. There's a congenital abnormality. The baby's going to the NICU. Now she's got a kit she can buy. Yay. But she's one out of however many that's going to need that. So do we need a kit? We can just go get syringes from the pharmacy. It's not the end of the world. But so to me, there's already an economic benefit starting here. People are now selling kits, and so now they're going to start promoting more and more of this, where we don't even know if it's a good thing. And from what I'm seeing, I'm not convinced it's a good thing. I think it's a lot again. It's intervening where we shouldn't be intervening.
Yeah.
It's creating a problem that we shouldn't have had. It's creating a low milk supply mindset going throughout your breastfeeding, which is we're already fighting that.
I'm so glad you said that, because me, as my natural-minded thinking, have never recommended it to my natural birthing mummies, because it doesn't make sense to me.
No.
And I just see how beautiful breastfeeding is designed and how beautiful it works. I can imagine, and would like to pick your brain on it, for our Caesar mummies, especially the elective ones, or that had to have earlier when the baby, when maybe all the hormones hasn't finished its work to set breastfeeding up, that breastfeeding kicks in a bit later, and that some sort of stimulation, even post-Caesar, could help.
I'm not seeing that much of that delayed onset of lactation. I don't see it. My bigger issue is that because a lot of our C-sections now are almost, they're trying to do it very naturally, in the sense that the babies are rooming in with the moms, the babies are being put skin to skin as much as possible, and Caesars are getting, we don't want them to happen, but they're getting very good in the sense of, there's very few complications that are happening around there. So babies are being put with the moms straight away. They should hopefully be being latched in recovery, or at worst back in the ward. So it's within an hour or so of the C-section happening that the babies are being latched. And I'm actually not seeing that much of a delay. To me, it's more a fear of the delay. So even in our hospitals where they do standard glucose monitoring, for the first 24 hours on the baby, we're actually not seeing that many babies needing
That's amazing.
Needing toppers, which is lovely, because I think it's the way they are doing the C-sections in a very positive way.
The more sensitive C-section.
Exactly.
Yes.
And so we're not seeing it as much. There are the months that it does happen. I mean, we know that. But to me also, I mean, as much as I am a lactation consultant and I'm all about breastfeeding, I'm all about natural, this is actually why formula was designed, for those 1 or 2 times where there is a slight problem with a sugar level or something. We can give a little bit, and then it's just once or twice, and we can use things like, I use a lot of the supplementary nursing system, the SNS. So we supplement the baby at the breast, so we're still getting the stimulation, we're still getting everything, or use a syringe, or use a cup feed, or use something. And also we can, if the mom is having a little bit of a problem, we can harvest colostrum right there and then.
Yes.
It may be 1 ml or 2 ml, but it's basically what she was going to be getting 2 weeks before that.
Exactly.
If not probably more, because now she's had a little bit of a hormone sort of. So I always say, let's not almost think there's going to be a problem when there's not really one happening. So
I like that.
Yeah, and I mean, C-sections, they're not the natural route of doing things, but it's not a complete barrier to breastfeeding. I mean, it's really not. It's just you've got to maybe work a little bit harder in the first 24 hours.
Have some more support.
Get your lactation consultants in.
Yes.
Maybe that's why in the prenatal one we'll know potentially if you're going to have an elective C-section. We'll know that by then, and then we can say, okay, let's as baby arrives, latch baby, and then maybe every 2 hours do a little bit of hand expressing, collect 1 or 2 mils of colostrum, so we can use that to top the baby up if it's needed.
Yeah.
And, it's also, I mean, we don't love it, and we always read these reports on 1 bottle makes a difference, and, to breastfeeding, but maybe you don't need it. Maybe there's no problem, and then if there is the odd problem with the sugar level, then we use the formula as a medication, and we give that to the baby. It's not poison. I mean, it's nutritionally complete.
Yes.
And we can just give that once off with an SNS or a syringe or something until we get to where we need to be. That is for me what it was designed for. That is for me, that's what should exist in the world, not for what is actually existing now.
Yeah, it's so reassuring.
Yeah, and if you've got the support, then we're not in a top-up culture. We're doing it for a good reason and it's evidence-based. So I always say to moms, don't do things out of fear, do things out of with evidence-based. So what I mean by that is, don't top up out of fear. Top up because the sugar levels are at 1 or 1.5 or something, or don't hand express out of fear that I'm not going to have enough colostrum. Hand express when we know you don't have enough colostrum.
Beautiful.
Okay, on the day.
Yeah.
And we can do it on the day. There's no reason not to. So
thank you. I think you demystify it a lot, even for me, because running it through my natural, your logic. It makes sense what you're saying. Absolutely.
Yeah, and we don't have the evidence.
Yeah.
So if we get it, if these trials go forward and we find out it's the best thing that's ever happened, then we change with the evidence, but
I doubt it.
I'm not convinced, to be honest. I think I'm going to spend a lot of money doing this next trial, and I think it's going to show.
It already shows that it's not much follow-up on all those studies, that it's a big thing. Otherwise, people would have jumped on it and get researching it.
Exactly. The researchers love a positive outcome, and they usually get grants and do it. And it's not exactly...
It's not that.
It's not rolling that forward. So I think there's a little bit of a no. My standard answer is don't do it unless we have a very good reason to do it. And those individuals, absolutely, we'll support you through it, get you doing it. But just doing it because you saw it on TikTok? Nah.
Oh, beautiful. Thank you, Samantha. It was really, very reassuring. And I'm sure many will be blessed by hearing this. Anything else you want to share with our mummies for breastfeeding awareness?
All my thing is just get support. Really
on time.
Yeah, unfortunately we have to pay for our village these days because we don't live in a village like we should anymore. So, but don't be shy. And my number one thing is a prenatal lactation consult. That to me is the best and easiest way to have a positive journey, is to actually do all of that stuff up front while you're pregnant, get the intellectual side done, so that when we get to the hospital or a home visit, we're just doing practical and we're just practicing a little bit, we're doing a little bit of problem solving. There's not having to do everything at the same time. So if you can do anything right, if you're going to choose anything, choose a prenatal lactation consult.
So where can women find you?
So they can find on social media, which as much as I hate it.
You have to have it.
Unfortunately, we have to have it. So I am on Facebook, I'm on Instagram, I'm theoretically on TikTok, but I've never actually posted anything. So I'm not on Threads yet. So all the socials, at the Baby Lady 243 will be there. Otherwise, you can phone me. I'm sure they'll put the number.
I'll put it in the show notes.
There. Or you can email me or just WhatsApp me. That's probably the easiest way to get it.
Wonderful. Thank you so much, Samantha.
Pleasure. Thanks for this platform. It really helps moms.
Yeah. Oh, that's good to hear. Hope you enjoyed that too. And please share it with a mom that needs to hear this message too. Thank you so much.
Thank you.
If you enjoyed this episode, please share it with a friend who would benefit. And remember to subscribe so you never miss a new release. If you're watching on YouTube, hit that bell icon for notifications. And if you're listening on your favorite podcast app, please leave us a rating or review. It truly helps us reach more people. We'd love to stay in touch and keep you equipped with our latest resources. Midwives and birth workers, head over to sensitiveMidwifery.co.za/free gift for your special resource. For moms, visit birthandbaby.co.za/free gift for more training and support. You can find both of these links in the show notes or description below. Thank you for being part of this community. And remember, you are making a big difference because you are shaping the future of humankind. Thanks for joining us, and I look forward to journeying with you.